Hello, I'm Sue Wong, Member of Provincial Parliament for Scarborough Agincourt. I'm pleased to be here today to spend some time to talk to some nursing students on patient advocacy to public policy and exploring the impacts of childhood obesity. So my agenda today for the presentation focuses on a little bit background, who is Sue Wong. Second, nursing and patient advocacy. Third, public policy and political process. Fourth, childhood obesity, what are the issues? The Healthy Kids panel, and finally my contact information. As this is the background, I was elected in 2011 in a provincial election and represent the area of Scarborough Agincourt. I'm currently the Parliamentary Assistant to Minister of Training Colleges and University, and previous to that I was the Parliamentary Assistant to Minister of Community Safety and Correctional Services. I've been a registered nurse for almost 30 years. Prior to becoming a member of Provincial Parliament, I was a trustee with the Toronto District School Board, as well as a board member on the Toronto Board of Health. I have been, as someone would call it, a lifelong advocate. In terms of nursing and patient advocacy, I want to remind everyone about the College of Nurses of Ontario's standards. In 2009, the College of Nurses clearly stated in the standard, quote, "The nursing standards are expectations that contribute to public protection. They inform nurses of their accountabilities and the public of what to expect of nurses. Standards apply to all nurses regardless of their role, job descriptions, or area of practice," end of quote. So as you can see from this expectations and the standard for the College of Nurses, we do have a role to play as nurses to be accountable to both ourselves within our professions and to the public. The next slide, it also talks about the College of Nurses expecting each one of us as registered nurses to demonstrate leadership. And I quote again another standard statement from the college. Quote, "Each nurse demonstrates his or her leadership by providing, facilitating, and promoting the best possible care or services to the public," end of quote. And the other expectations by the College of Nurses for each one of us is the fact that leadership does not limit to nurses in our formal leadership positions. All nurses, regardless of the position, have opportunities for leadership. This means that even frontline nurses, not just nurses in management position or myself in the political arena, we all have a role to play in terms of the leadership. So all of us have a responsibility and requirement to demonstrate leadership. So in terms of the healthy public policy, nursing role, and nursing political action, I want to share the next couple of slides about what the College of Nurses expect and require each one of us in terms of leadership, and some of the examples that I have demonstrated in terms of my leadership role. So in the left-hand corner of this slide, left-hand column of this slide, talks about the CNO requirement of leadership. So the first one talks about collaborating with clients and healthcare team. So an example that collaboration for myself is that I collaborate with my constituents, whether they're students, teachers, constituents, just local residents and business leaders, nonprofit organizations like the Agincourt Community Services, and other agency to address the issue of healthcare, or in many cases not just about healthcare. The other piece that the College of Nurses require us to do to advocate for our clients in the workplace and in the profession. For myself, as a member of Provincial Parliament, I have advocated for constituents on a number of issues, whether it be seniors care, community-based nursing, advocacy for local schools, and for students. Third, the College of Nurses requires to demonstrate leadership to provide directions, collaboration, to share knowledge and expertise. This means that each one of us as registered nurse, we need to meet with others, our stakeholders, in my case, they're the constituents, as well as the general public, to provide direction in the case of recommendation, in the case of suggestion, collaborating with my stakeholders. Both provide information and expertise. I mean, just to give you an example, recently I held a public meeting in my riding of Scarborough Asian Court, inviting the chair of the Ontario Lottery Gaming Corporation, Mr. Paul Godfrey, to come to the riding to speak. So through that public meeting, that the constituents have an opportunity to learn, but more importantly, to dialogue with me as the member of provincial parliament. So there's an opportunity to have those conversations. In the next slide, I also want to talk about leadership means that we have to participate in nursing organizations, in committees, and special interest groups. So in my role as a member of provincial parliament, I was sitting on the Healthy Kids panel. I will talk a little bit about this panel in a minute, as well as the vice chair of the Legislation Regulations Committee. As well, I sit on a number of other non-formal groups and activities in my riding. I chair a informal business organization in my riding, as well as talking and working with local youth. The other piece about leadership at the College of Nurses requires us to do leadership in both formally and informal roles. Now, in my role as a member of provincial parliament, I see my role as more formal as opposed to informal, but I do a lot of informal stuff as well in the community, meaning that when I meet with my constituents, I meet with them both as a member of provincial parliament, and many times I also advocate for them in terms of the issue of healthcare, because we know healthcare is a big item provincially for a member of provincial parliament. The other piece the College of Nurses require each one of us to take to do is to take actions to resolve conflicts, because we do have conflict every day. The question is, as registered nurses, what do we do about it? So in terms of example, I deal with conflict every day, whether it be taking actions to resolving conflict or misunderstanding or miscommunication of proposed legislation. Recently, the Governor of Ontario passed legislation and Bill 2, Bill 13, and Bill 115. All these provincial legislation deal with education, and some deals with healthcare. So conflict exists in our working environment. The question has to be, what are we going to do about it? There are challenges for us as nurses in terms of political actions. In this particular slide, I share some of the challenges I experienced both as a registered nurse and as well as an elected official. First thing first, we recognize the fact as registered nurses, many of us have limited knowledge, both knowledge and skills in dealing with the political process. Both in our undergraduate and graduate nursing program, there's a lack of knowledge and skills or discussions about how to develop healthy public policy. For example, when the government introduced the Health Action Plan about over a year ago, it was very clear that this action plan will have a huge impact into the health community. Yet, I did not receive, as a member of provincial parliament or as a registered nurse, because I'm still a member of the College of Nurses, a letter of concerns or support of this health action plan. So very clearly it tells me the nursing students, both at the undergraduate level and at the graduate level, have not really thoroughly read this plan or have any comments on this plan, which I would like to encourage. The other piece I want to use an example is the Healthy Kids panel, which I will talk a little bit more about. This particular panel is created by the Minister of Health, Minister Matthews, last year to address the whole issue of childhood obesity. Again, there's limited interactions or conversation within the nursing discipline to talk about this and also encourage them to feedback to me as a member of the Healthy Kids panel. The other challenges as nurses, how to get involved in the political arena, is a resource issue. You know, it does take time, it does take money in order to be a good advocate. You will need to work with people, you will need to collaborate, you will need to meet. So some of that resources will mean time. You need to advocate dedicated time to have those advocacy opportunities to meet with your stakeholders and to work with your stakeholders. The other limitation is the knowledge and skills in handling and managing media. There isn't a day go by that we're not aware of the media's role. Here at the Queen's Park, I'm aware of the media in our building every day and everything we do. Because in the legislature, we actually have 4 cameras there, and when the House is in session, the camera's on live, and how to deal with the media scrum when the media asks a question, what kind of timely response, but more importantly, what type of response as nurses that we're prepared to share, but more importantly to address. Because if you don't say it correctly or your facts are not correct, there will be consequences. Because at the end of the day, media can also be an ally for each one of us as advocates in the community. Because through the media, we can educate, inform, and provide support to our community. There's also limitation as nurses in terms of the area of debating skills. I still remember when I was teaching at Humber that we had some healthy conversation and discussion in my classes. The Canada Healthcare System course that I taught, and debating on the issues of different healthy public policy. Nurses in general have limited skills in debates, and I every day at the legislature debate on issues, debate on policy, but most importantly, part of the debate is having that conversation with a colleague opposite, also within colleagues among my own party. So debating skill is critical in order for us to have those political activities. The other concerns and limitations about nurses in general is the time constraints. We're quite aware of the fact that as a registered nurse, we have a limited time, each of us per day, and that we need to put priorities on how to manage our time. The other concerns and challenges for us as nurses is the credibility of each one of us as nurses. How many of us actually actively involve and engage in our community? Probably very few. So I'm going to encourage each one of us to take a time to pause a minute and to really feel a sense of responsibility, a sense of community. This is what the Premier has asked in the throne speech, that each one of us has a role and responsibility, not just within our profession, but also within our community. How do we increase our own involvement and, in essence, create our own credibility within the profession? The last challenge here is dealing with the public, because every day when you're in the public life, you have to deal with public issues. I was saying to my staff recently that my role as a public elected official, that I'm a face of my riding, but also many times a face of the government, that we are on every day, 24/7, especially during critical times or where there's a critical incident where the media will approach each one of us to ask for a message or to ask for a statement. So are you as a registered nurse prepared to be the public face, prepared to speak publicly with knowledge and skills and ability to address those issues? So those are some of the challenges that I face, and as well as in the past and continue to need to be addressed. The other piece I want to share with you as nurses is how to empower yourself and your colleagues to get involved, okay? It starts with early engagement within your own community. Well, I know as a registered nurse, I started my engagement very, very early in my political career. I started when I was in high school, and getting involved means that being informed about the issue, doing the homework, but more importantly, working with others and participating actively in my riding. And most simple things such as participating in the election process. Next year we're going to have a municipal election for sure, because every 4 years there's a municipal election. But the fact that many of our young nurses, and even nurses in general, don't vote. And how do you engage when you don't vote, or even participating in a political debate? And that's what election is all about, getting involved and being engaged. The other piece about as nurses being empowered is that you need to recognize yourself, not just as a registered nurse. You do have a role to play to influence healthy public policy or legislation. For example, I started my nursing career back in the 80s, and it was a long struggle with all the activities that we did in terms of the whole issue of tobacco legislation and tobacco awareness. And 20-somewhat years later, and look at what we have, the environment that we have right now, that smoking is considered taboo, and all public places, both in restaurants and in workplaces, are smoke-free. And now the provincial government recently announced more support for those who are smoking to quit smoking. So some of the stuff that I've done over 20-some years ago have become a healthy public policy and have made into legislation. So I know I do have a role to play, first as a registered nurse and now as a member of provincial parliament. The other advocacy and empowerment that I'm going to encourage each one of you to do is being active in your community, whether it be a parent in your own school community, joining the school council, or just being involved with your own local clubs or agencies. We have nonprofit agencies across Ontario. Be involved, be engaged, because your nursing role is not just in your own confine of your own workplaces. You have a responsibility, as I indicated in previous slides, that the College of Nurses expect each one of us to be actively involved, actively engaged in our community, and that we have a responsibility and we need to be leaders within our community. The public expects us to be leaders in our community. The other piece is the fact that all of us need to participate in different agency, association events. Every riding in our province of Ontario, there's 107 ridings in the province of Ontario, have many events and activities. You do have a role and you can participate, and most of these events are free. You just need to be there and have those conversations with your local member of provincial parliament. But the other piece is getting involved and being engaged requires you to do your homework, because you need to know, what do you stand for? What is your position? You also especially need to know your opponent's position and their issues, because by not doing your homework and being prepared, you're going to lessen your ability to be a strong advocate for your community. The other piece about empowering yourself as a nurse advocate is that you need to surround yourself with good, strong team members, meaning your supporters, your cheerleader, but most importantly, these are the people that you can trust, that will support you through good time and bad time. Believe you me, I've been in the public office since the 1990s. I have many of those strong team members surrounding me, giving me strong advice, good advice, and then I can make my decisions. The other piece is, in order to be successful nurse leaders in political arenas, that you need to secure funds, because you need to sponsor or print literature or preparing ads in the local paper. And these kind of activities are not cheap. They're pretty expensive. So you need to secure some kind of financial resources so that you can be a strong voice, you can be a strong advocate. And part of the building a strong team means that you will need to recruit volunteers and your supporters. The volunteers should not be just exclusively your family. They need to be your colleagues. They need to be your community. They need to be those who are caring, who are as compassionate as you are about issues that you're concerned about. And most importantly, when you're empowering yourself to be a nurse leader in your community, you need to believe in yourself, and having fun is a really critical piece. Now, I'm going to spend the next couple of minutes to talk about the whole issue of childhood obesity, because this is what this discussion I wanted to share with you, and what was my role as a member of provincial parliament sitting on the Healthy Kids panel. So as you all know, childhood obesity is a serious health issue that affect our community, especially as nurses. We know that childhood obesity is linked with many risks associated with hypertension, type 2 diabetes, heart disease, gallbladder disease, strokes, and certain types of cancers. And data shows that obesity is the leading cause of disease and costs the provincial government about $4.5 billion. And some of the challenges we are confronted with as the government of Ontario is the fact that we need to not just talk about provincially, we need to seek out broader base engagement and get input and suggestions and recommendations from the various partners and sectors. And I mean not just exclusively from the health sectors. I'm talking about the food service industry. I'm talking about educators. I'm talking about parents. I'm talking about the media. So each one of us have a role to play in terms of childhood obesity. And in this particular slide, I indicated about the role of parents, caregivers, meaning the early childhood educators, teachers in the classrooms, myself as a member of provincial parliament, as my colleague, the industry, the media, all of us have a role to play to promoting the health of the next generation. And as a government, we made a number of commitments. It was all clearly laid out during our election platform in 2011, and we reiterate that commitment in discussion. So last year, when the minister created the Healthy Kids panel, she brought together a very large stakeholder group. They include the experts from the hospital sectors, from the university, and healthcare leaders, nonprofit group, from the industry, from the food service industry, from the media, to come together to tackle this issue of childhood obesity. Minister Matthews also put in a very ambitious goal to reduce childhood obesity in Ontario by 20% in the next 5 years, and that's very ambitious. The other piece here is Minister Matthews also wants to see the recommendation from the Healthy Kids panel, how best to meet this goal, and what are the ways to reduce childhood obesity to improve the health of our children. Because at the end of the day, this panel not just come with recommendations, it also has a role to play to do some advocacy beyond the traditional health sector. So we do have a responsibility collectively, province-wide, to protect the health of this current generation and the future generation. And part of the Healthy Kids panel is to identify some of the child obesity rates and some of the factors that contribute to this rate, and as well as improving the health of our children. Because this is not just about one particular issue of our childhood obesity. We recognize the fact childhood obesity is multifaceted, and that we need to look at a more comprehensive and more innovative approach to achieve this goal of reducing childhood obesity by 20% in 5 years, okay? Because not just about the health, the financial cost, but also about the economy. Because at the end of the day, if this generation of kids are dying before their parents, there will be consequences in terms of economic and the economy for our province. So a part of the panel's discussion was to look for evidence-informed solutions, being publicly accountable, and looking for cost-effective ways in terms from the global and provincial austerity measure to address childhood obesity, and looking for viable and sustainable implementation of childhood obesity measures. And on this particular slide, I want to share with you the names of the childhood obesity, the Healthy Kids panel, and who the members are, and their background. As you can see from this slide, it's a very diverse, province-wide membership, and we did a lot of tough and heavy lifting in terms of activities and meeting sometimes 2 or 3 times a month to talk about our recommendations, to speak to experts, etc. So it was a very, very robust and honest, strong conversation about childhood obesity. All the panel members were invited to share with the panel, co-chair, our experiences and expertise, but also to get other opportunity to talk to other representatives nationally and internationally about this topic. We also look at the landscape across the various relevant sectors, like I mentioned about the fast food industry, but also the media. What is their role in terms of childhood obesity? How can we look at different strategy to reduce this major health epidemic in Ontario? We also want to learn and share the knowledge and expertise that contribute to development and recommendations on terms of the interventions and approaches to reducing childhood obesity in Ontario. The panel, the Healthy Kids panel, also look at the gaps, the challenges, and many potential opportunities in terms of reducing childhood obesity. And some of these challenges and opportunities came not just across Canada, but also around the world. We heard some very, very experts in different jurisdictions, and they share with us some of the evidence that they have done and some of the intervention they have done in their jurisdiction. So it was very, very informative and very engaging. The other piece is, as a panel member, we would have be given the task to access, to consult with the various diverse groups, the direct sectors. For instance, we were looking at the demographic across Ontario, whether it be children, youth, but we also engage our parents, because we know many of the young people, the food came from their parents. So we need to engage them, have a conversation with them, and especially new Canadians. What is their supported needs and their concerns about the whole issue of childhood obesity? As a member of the panel, we have been encouraged to engage the different networks to have a better understanding of childhood obesity, because this issue is very complex, and it will require a multiple strategy. But more importantly, we need to learn and listen and hear from different jurisdictions what are their solutions to implement this particular challenge. And I want to share with everybody this particular website is a provincial government agency website about the Healthy Kids panel, and you can find out more about the panel in terms of their work, the terms of reference, and the membership. And then as well as here is my contact information, that should you have any questions or concerns you want to raise after this presentation, please feel free to send me an email or contact my constituency office, or through the Ministry Training College or University. I look forward to have a continuous conversation with you, and have a great day. Thank you.